I would say probably the number one fear, and by fear I mean like in their bones terror of 12, so 12 is 7th grade, right around there, is isolation. At that age, there is an almost primal fear of ending up isolated. And this is true for all 12-year-olds. And so if a 12-year-old with a chronic health condition is bringing across concerns like, this makes me different, this makes me strange, I feel like I stick out, I think the way to address that as the loving adults is to think, okay, this kid is terrified of ending up isolated for being different.
Episode 137, How do I parent a teen with a chronic health condition? I'm hearing from so many more of my friends who are now required to go into work and not just be at home where you have a little bit more flexibility. And one of the things when you're talking about childcare is when your kid gets sick. And oftentimes you hope it's a day if you're lucky and then they go right back to school. But Lisa, what if it's longer?
Yeah.
And sometimes it is, right?
Yeah, no, we're at that part of the school year where kids are starting to get sick with stuff and they come down with it and you kind of deal with it for a few days and it feels like this giant disruption. But there are a lot of families who are dealing with a situation where their kid has a chronic health condition and they have to really make adjustments as a whole family around that.
It was fascinating, Lisa. We got 2 fabulous letters about kids with chronic health conditions talking about different subjects. This one comes from a listener in England and it reads, Hi, Dr. Lisa. Please can you devote an episode to how parents can support preteens and teens who have a chronic medical condition? Our 12-year-old daughter has type 1 diabetes and recently started at a new school. Her old school was small and cozy, and we feel she was fairly inoculated from the difficulties of life with T1D, type 1 diabetes. Now that she is 12 and at a new school, she's acutely aware of being different from everyone else. Something no 12-year-old wants to be. She's a gentle, kind kid who has a lot to deal with on a day-to-day basis to manage her condition. She was bullied early on at the new school, which we alerted the school to, who seemed to take appropriate measures and are providing support to her at school regarding building social confidence. We've also assessed psychological and therapist support for her and spend a lot of time together as a family. But she seems to lack social confidence. Would love to hear your thoughts on how best to support children in similar circumstances. Life is hard enough between the ages of 12 to 16 without a chronic medical condition. Thank you so much. Wow. First off, I guess in my ignorant mind, I never viewed type 1 diabetes as a chronic health condition.
Yeah, I think it's a fair description. And I think the way we would think about it, I mean, I'm not a medical doctor, right, is that it needs constant management.
That's a good point.
It is, and by constant, I mean all day, every day. Anyone dealing with type 1 diabetes is having to keep an eye on their blood sugar and decide how much insulin to inject to regulate their blood sugar. And the thing that's so complicated about this is that the things that are just typical parts of a day, like what you eat, how much you exercise, literally how stressed you are, those will all affect blood sugar. And so anyone managing diabetes is needing to keep a very, very constant eye on what their body needs.
It hurt my heart about the part where she's aware that, she's got the sense that she's different. What do you think her parents can do to help her with this sense that she understands she's different and it's starting to stick out and show?
So number one is I would say, don't deny it. It does feel different. And the kids who I have been around or cared for who struggle with type 1, not struggle with, but live with type 1 diabetes, they show up to places with their own snacks. They're monitoring their blood sugar levels. And, there's a constant monitor that can be attached to the skin. It's often on the upper arm. And it's actually a really helpful thing because it actually constantly is keeping an eye on glucose levels as opposed to having to do finger sticks all the time. But it means that they have a plastic little machine that is attached to the back of their arm. And Reena, do you remember being 12, 13, 14 and like having a haircut you didn't like or a pimple that felt really prominent and being like, I cannot go to school. This looks wrong. This looks different, right? I think if we can tuck into the way in which those even physical or visual differences can feel so exquisitely painful at that age, I think we can have a lot of empathy for like the adult may be like, this is great. You've got a blood sugar monitor that like just lives on your skin. You don't have to pay attention. This is a great outcome. And then to a 12-year-old, it may not feel like a great outcome. It may feel really awkward and strange and different.
So when you have a child who's going through a chronic illness of some sort, and you know that the illness makes them look or feel differently, what's your advice to the parent for tackling that? Because you can't avoid it and you can't brush it aside and say, oh, no, it's going to be fine.
I mean, I think I'm so grateful to be I'm not a developmental psychologist by training, but my training is very developmentally oriented. So I think about, okay, well, this is happening in the box that is age 12, right? And that anything we're going to advise is going to really center on what it means to be 12 and, the ages right around it. And here is the thing that I think can inform how an adult walks up to this. I would say probably the number one fear, and by fear, I mean like in their bones terror of 12. So 12 is 7th grade, right around there, is isolation. I think that at that age, there is an almost primal fear of ending up isolated. And this is true for all 12-year-olds. And so if a 12-year-old with a chronic health condition is bringing across concerns like, this makes me different, this makes me strange, I feel like I stick out, I think the way to address that as the loving adults is to think, okay, this kid is terrified of ending up isolated for being different, right? Like it's almost always about like, I'm afraid I'll be isolated. So then all energies go to isolation prevention, right? Making sure that kid does not feel isolated as a result of their difference.
How do you as a parent make that happen? Because I'm curious about this bullying part, Lisa, right? Like what's up with that?
I didn't like that. I was really bummed to hear that. And I like, who knows what the dynamic was. And the thing I was sort of bummed and surprised to hear that is that bullying happens and it's awful when it does. But it's also my experience that usually teenagers are pretty good about leaving alone kids they see to be vulnerable. Like I've often been just absolutely really deeply impressed by how teenagers, if they sense that someone's vulnerable, they'll actually rally around that kid. So I was really bummed to hear that.
So why do you think they're doing that then? If your sense is you've seen this over the years, and usually they're not picking on the kid who has a chronic health issue.
Yeah, I mean, who the heck knows what's going on? But I mean, there are kids who are very insecure or feel very anxious in their own way. And the form that it takes is going after a kid because they are vulnerable. So that could very well have happened here. And what I liked hearing was they brought it up with school. It feels like the school was on it. So I don't want to in any way diminish or count out the fact that, a kid who's vulnerable may be more subjected to bullying maybe than a kid who's not. But I was really sorry to hear that had happened. So the first thing is to do actually what the parents did. If it's really bullying, and bullying is where there's a power differential and the kid on the receiving end is unable to protect themselves, you do actually need to alert the school. Like it is important. Don't call the other family. Don't, try to handle it yourself. Get the school involved. And from what little information we have, it sounds like they did and it went well and they can move forward. So I was glad to hear that it seems somewhat resolved, at least in this description.
That's good advice. Also to hear from you to just, on this issue, just deal with the school directly and have them sort it out quickly.
Yeah. But so then if we just tackle this straight up from a don't let this kid end up isolated question. So there's a few things that parents can assess. So one is, does she have at least one good friend? And I will say, your kid does not need a big social network. Kids are not necessarily made happier by having a big social network. They're often made more stressed because they're trying to juggle too many, relationships at once. And I want there to be no bullying, but even a kid who is subjected to bullying, you're looking at two very different situations if that kid has no friends or if that kid has one good friend. Because if a kid is subjected to bullying and they have no friends, that is a 5-alarm fire crisis. If a kid is dealing with bullying, but they've got somebody at school who's like, ignore them, that kid's a jerk, come hang out with me, don't, that is a very different scenario. So do they have one friend? Do they have no friends? Like, you want to assess that. The other thing I wonder, and a lot of times kids will be resistant. Sometimes hospital systems, medical systems will have ways where there's like support groups for kids and families dealing with similar issues. Mm-hmm. So I would also wonder, is there a type 1 diabetes program that is extra? Obviously they have medical care, they have doctors who specialize in this. Is there something that the hospital or the medical system is providing that's like, and our families meet once a month to talk about this. Mm-hmm. And so your kid can meet other kids who are dealing with this. Now, most 12-year-olds worth their salt will be like, you have got to be kidding me.
No way.
Like, I would
not
rather
gonna do it.
Poke my own eyes out. Like, I'm not going. But I think that that's a possibility.
Lisa, what do you do if, obviously, as you mentioned, they don't want to go to the social groups and they don't have that friend because it can be so isolating often, right? That you climb up into a shell. How does a parent respond then?
Well, and especially like climb up into a shell does sound a little bit like this letter. What she's saying is this child has very low social confidence, mm-hmm. Is very anxious. These are my words about how things are going to go socially. So the rule here, Reena, is the only way to get past an anxiety, the only way to build confidence is by doing the thing, Like, the more you wait or daydream about how it can go wrong, mm-hmm. the more anxious you become. So what I would say in terms of the low social confidence, or a kid who's like feeling very reluctant to put themselves out there, is can the parents create very low stakes, high chance of success conditions for her to actually start to wade into being a bit more of a social person. There's a beautiful book called The Science of Making Friends by mm-hmm. Elizabeth Lageson. And so I would recommend parents get it. We'll put it in the show notes. And it really is a very wise book about like how to initiate conversations, how to keep conversations going, how to deal with bullying comes up in there. So I would recommend the parents get this, look at this, decide how much they want to share it with their kids, or just use it as their own like coaching manual as they coach their kid. But use resources like that to be able to provide good advice, and then see if you can't say like, why don't you invite that one kid over, like a kid who is going to be, mm-hmm. likely to be a fun guest and a wonderful kid, and just treat it all as practice, right? Mm-hmm. That social skills are like any skills, you develop them through practice. And so she may need to practice her social skills, so you want to set her up for success.
That was a beautiful letter that we first read from England. But I want to get into this other letter because it tackled some other issues on chronic health conditions that we thought were important. Hi, Dr. Lisa. My 12-year-old son was diagnosed with type 1 diabetes 18 months ago. It all seemed easier for both of us when he was 10. Now he's 12 and I have to weigh his food, ask him, did you dose for that? Not to mention, there's just always an undercurrent of me being aware of what he's eating. He hates this. When he was 10, he took it in stride, from my perspective at least. Now he forgets to take insulin. He gets mad when I remind him. He sneaks food. I don't know how to not turn it into a point of contention for us. I understand that he can't fathom if you're not careful with your health in 20 years, you could have X problem. So how do I make him care? I don't even know how to ask the question. Do you have any suggestions? Why does it feel, Lisa, this situation is worse, even though he's only like a couple of years, like 18 months older?
Yeah, no, it's really interesting. And I think I'm so glad we're doing these two together because it's the same disease, right? They're both struggling with the same thing, and they're actually the same age. But we're looking at two very different dimensions on this. Yeah. And which, again, I love that we just happened to get two letters that lined up so beautifully in the kind of facts of the situation, and yet told such different stories about what it was like to parent that child. Because again, it just calls so much to our attention, like how complicated parenting is, how specific it is, so how much it's you and your kid. Okay, so Reena, this piece around like at 10, it wasn't that big a deal to coach this boy. He was much more amenable to keeping an eye on his insulin as he was supposed to. And at 12, now this all feels like it's falling apart. I will tell you, I have seen this pattern over and over again around medical concerns, that it's easier for kids pre-adolescent, so 10 is usually like right on the cusp, pre-adolescent, to tolerate having medical concerns. And it's easier for adults to tolerate having medical concerns that involve other people intruding on their bodies. Right? Because when you're a kid, you're used to people having their hands on you in the, care and people telling you what to eat and when. And when you're an adult, you've had time to have a sense of like, my body is independent and autonomous. So now I can decide to grant you access to give me medical care. Teenagers fall into this perfectly normally developmental adolescent window of like, I want autonomy. I want bodily autonomy. And they want it about all sorts of things, what they wear, how they do their hair, all of that. So it's a real collision of forces when a teenager has a medical concern that involves people to be in their bodily business.
Totally.
And so that is why, even though he's older and theoretically more mature, it feels like it's going backwards in terms of this mother's ability or this parent's ability to coach him on the management of his own body.
So how do you stop this from turning into a fight?
Right. And this is like, we were talking last time about stuff that could matter when you're 30.
Yes.
Right?
Yes, on the crop tops, yeah.
Yeah. So this is one that's tough because this could matter when the kid's 30. That, it's scary to have a kid with type 1 diabetes because if they're hypoglycemic or hyperglycemic a lot, like it can have long-term implications for their health. So nobody's in a good position here. The poor kid is having to deal with this. The poor parent is having to deal with this. So I think that one way to go about it is to really focus on his health and his safety, right? It's not about the kid bending to the parent's will, but really, and this is what we do, not just for type 1 diabetes, this is what we do for how you drive, for how you, go to parties. This is about his health and his safety. And that the parent is wanting him to take good care of his own health and safety. Like that, it's his own autonomous interests that are at stake here. Now, one way she could go about it, I'm saying it's a she, I think it's I don't know, the parent could go about it, it doesn't really matter. The parent could go about it, is to say, buddy, I don't want to be in your business. I don't want to be asking you if you've eaten. I don't want to be asking you where you are with your insulin. I don't want to do this. You don't want me doing this. Like, you don't want me up in your business like this. But here's the deal. If you're not on top of it, I have to be on top of it. So if you want me out of your business, you got all the power, buddy. You start taking control of this. So that would be the conversation to start with.
Lisa, in this letter, they talk about how the child really hates when they're asking about everything they're eating and on top of them about this. What if they're sneaking food? Like, what if they're doing something that could really have serious critical issues on their health?
Yeah, no, it can be very dangerous. So this is actually a really interesting place in the care of type 1 diabetes in particular. Most families at this point have an app, if they can afford it. This is not something that is affordable to everybody, but insurance companies are increasingly, I think, very good about covering this. So the kid will usually have a continuous glucose monitor, and the family will be able to have an app that alerts them, that lets the parent actually see the kid's glucose situation wherever the kid is, and even has an alarm for when things are concerning. Now, I am sure I'm grossly oversimplifying how complicated the realities are of managing.
But your point is you can this is something that you can keep track of and manage.
You can keep track of. And so the parent does have a backup system and can have a backup system.
Okay.
And is not entirely hoping and praying that the kid is making good choices all the time, because they are kids. They will not be making good choices all of the time.
Yeah.
So I think that, thank goodness for these evolving technologies where parents can actually have sort of a safety net in there.
Right.
And so I think that makes this better. And I think it really is about saying, you want to be independent. I want you to be independent. Now, the thing that's hard, Reena, is the kid may be like, yes, I hear you. I want to do it. I get it that I have all the power about getting you out of my business. Yeah. Now, we've talked a lot about executive functioning on this podcast. Okay, the executive functioning required to manage type 1 diabetes well is not small.
I know. And that's what I worry about. How dangerous is this really? Because, one bad spike, it can take one forgetful moment for something serious to happen. How dangerous is this really?
I don't know that I know. I mean, I think it can be very, very dangerous. And I think that things can spin out of control. And so I get it where a parent can be very, very scared. But what I would say, and I mean, Reena, think about the amount of work we're talking about for the parent involved here.
Absolutely.
I don't say any of this lightly. So first, I think it's about transferring it to a fight not between the parent and the kid, but between the part of the kid that wants to do whatever the heck they want to do and the part of the kid that wants to take good care of themselves, right? And really try to make it, that's the conflict. And then I think the next part is to say, all right, dude, you want to take this over. I want you to take this over. Are you able to, and what structures can we put in place to help you take it over? Like, do you need reminders on your phone? Do you need a check-in with, somebody else who's not me, right? To feel like you're in charge of this. So trying to disentangle a little bit, like the fact that you don't want this to be a power struggle between you and your kid. That's one issue. But then if you can get out of the power struggle, does the kid have the supports they need to manage it effectively on their own? And what kind of supports can the kid and the parent come to agreement should be put in place?
Does it get any better?
Yeah, I think when they hit adulthood or yes, here's what I will say. And I think that, colleagues of mine in the medical field will say, oh, yeah, no, later in life, people manage their type 1 diabetes quite effectively. Adolescence is really hard because you don't want people in your business as a teenager. That is typical and expectable. And Reena, we're talking about in your business, like, what did you eat and when did you eat it? And how much did you exercise? And you're going to that party. Are you going to drink at that party? Because drinking at the party means something different for a kid with type 1 diabetes and a kid who, doesn't have it. So it's really hard on kids and their families to have anything like this.
Yeah, I've learned so much. And you're right. I think that what got me about this letter, and we felt we needed to do these two different ones, there were such different angles of the same problem.
Yeah.
And this parent saying between the ages of 10 going to 12, boy, have we noticed such a difference. Yeah. That was really remarkable to have you walk us through it. Lisa, what do you have for us for parenting to go?
So for parenting to go, what I would say is if you have a kid with a chronic health condition, I hope you have all the support in the world, right? You deserve it and you need it. And I hope you have it. The other thing I will say is every one of us is parenting in a community with kids with chronic health conditions. And so as our own kids become aware of it, if our kids don't happen to be in that category, I think there's some really good parenting that can go on. I think we can work to learn about what that child's experience might be. And then if that kid is close enough into our own kid's social circle, so if they're 4 social circles away, you probably don't need to give it much, consideration. But if they're closer, you might say to your kid, if you had to struggle with what this kid is doing on the daily basis, what would you want from other people? How would you want other people to be? And then, have your kid think it through and they'd be like, okay, go do that. Go be awesome. And so I think having a chronic health condition as a child is incredibly challenging, hard on families, hard on the kid. And I think every single one of us can be part of the solution.
It's great advice because you want to help often when you see this within your own community, but you don't know what the appropriate steps are to take. And what I've learned from you, one of the big things is having conversations really makes a difference with your children.
Yep. They'll come up with solutions we never thought of.
It's a great point. Yeah, that's a great point. And next week, we are going to take on a topic that's really fascinating. Should you leave town and let your kids be alone? I mean, clearly there's a certain age for this, but...
should you let your teenager house sit?
Your teenager, should they be able to house sit? The things you might not have thought of that Lisa's going to walk us through. I look forward to that one. Lisa, I'll see you next week.
I'll see you next week.